Welcome to this presentation about weight loss surgery at the Royal Berkshire Hospital NHS Foundation Trust. We have a large multidisciplinary team consisting of surgeons, physicians, anaesthetists, nurses, dietitians, psychologists, pharmacists, as well as an experienced team of ward and theatre staff who will care for you during your hospital stay. Who is eligible for weight loss surgery on the NHS? We base our eligibility criteria on the 2014 NICE guidelines. These state that you may be eligible for surgery if your BMI is 35 or above and you have a weight-related health condition such as type 2 diabetes or uncontrolled blood pressure, or if your BMI is 40 and above without any other weight-related health problems. Surgery is not an easy option, so in order to be eligible for surgery, all patients must have tried to make all reasonable dietary and lifestyle changes. You must be fit and healthy enough for an anaesthetic, and the benefits of surgery must outweigh the risks. You will also need to be able to commit to long-term, sometimes lifelong follow-up. We offer several types of surgery here at the Royal Berkshire Hospital. We offer the Roux-en-Y gastric bypass, a sleeve gastrectomy, a one anastomosis gastric bypass, an adjustable gastric band, or you may also be offered a gastric balloon if your BMI is above 60. All our surgeries are done laparoscopically, which is sometimes called keyhole surgery. We also perform some of our surgeries using a robot. Weight loss surgery is a lifelong change, and in accordance to the 2014 NICE guidelines, you'll be required to complete our preoperative pathway prior to surgery. This presentation is the first step on the pathway, and you'll also be given an opportunity to ask questions either via a telephone call or through a video link. If after watching this you decide that you would like to proceed with surgery, you will then be invited to our medical multidisciplinary team appointment, sometimes called an MDT appointment. There you'll be assessed by a consultant physician, a registered dietitian and a clinical psychologist. After this assessment, the consultant may order some investigations, such as blood tests or sleep studies. If you're already under the care of another specialist within the trust, you may contact them just to see if weight loss surgery will have any impact on your other health conditions. Your next appointments after that will be to attend our pre-op preparation sessions, which are 4 sessions over 8 weeks and are currently being delivered via a video link. If you are unable to access online media, please let us know when you attend your medical MDT appointment so that we can arrange an alternative. During your pre-op pathway, we ask all patients to aim for a 5% weight loss target. That's not because we're trying to make life difficult for you, it's simply because any weight loss before surgery makes the surgery safer. Once you've completed your virtual group sessions, your next appointment will be a follow-up either face-to-face or via a telephone call, just to make sure that your health or medications haven't changed since we last saw you. After that, as long as everybody is happy, you'll be invited to attend our surgical MDT. The primary purpose of this is to see the surgeons, but you may also see an anaesthetist or other members of the bariatric team. Once this has been completed, and as long as everyone is still happy to proceed, you'll get an appointment for your pre-op assessment and a date for your surgery. I would now like to talk a bit about the surgeries that we offer. Firstly, the Roux-en-Y gastric bypass. Roux-en-Y gastric bypass surgery. Gastric bypass surgery works by decreasing the amount of food you can eat at one sitting and by changing the hormones released in the gastrointestinal tract. The surgeon staples across the top of your stomach, sealing it off from the rest of the stomach and forming a new pouch. The resulting pouch is about the size of an egg and can only hold about an ounce of food. The surgeon then divides the small intestine and sews part of it directly onto the new stomach pouch. When eating, food now passes into this new stomach pouch and then directly into the small intestine. The food has therefore bypassed most of your stomach and the first section of your small intestine. This alters the production of specialised gut hormones that control appetite and satiety. This leads to a decrease in appetite and often also reduces cravings and thoughts about food. Sometimes people experience taste changes, meaning certain foods may taste different or suddenly become unappealing. The operation is done under a general anaesthetic. This means you'll be asleep during the whole procedure. Gastric bypass is routinely done using keyhole or laparoscopic surgery, and the operation usually takes around 2 hours. You will usually be able to go home 1 to 2 days after your operation, but it can take up to 4 to 6 weeks to make a full recovery. Advantages of the bypass. The hormonal changes cause reduced appetite, taste changes and a reduction in food cravings. You have a small gastric pouch which will limit how much you can eat in one go. Weight loss starts from the time of surgery and you can expect to lose between 65 and 75% of your excess weight over a 2-year period. Gastric bypass surgery has the highest and fastest remission rate for type 2 diabetes. Gastric bypass disadvantages. There is a slightly higher risk of early complications due to the technicality of the operation itself. Because of this also, there is a slightly longer recovery time. You'll need to commit to taking lifelong daily multivitamin and mineral supplements, and you may experience something called dumping syndrome, which although does not pose a serious health threat, can be quite unpleasant. Dumping syndrome usually happens after you have eaten something sugary. Next, I'd like to talk about the sleeve gastrectomy. Sleeve gastrectomy surgery works by decreasing the amount of food you can eat in one sitting and by altering the gut hormones that affect appetite and satiety. A sleeve gastrectomy is an operation that reduces the size of your stomach, which is achieved by stapling the stomach along its length. The excess portion of the stomach is then removed, leaving a long, thin tube or sleeve of a stomach. Although the shape of the stomach is drastically changed, it continues to function normally, although the quantity of food consumed will now be much less. The gastric sleeve works in 2 ways. Firstly, it is a restrictive procedure, meaning that it achieves weight loss by restricting the amount of food you can eat in one sitting. It also works because it removes the part of the stomach that produces some of the hormones that stimulate appetite and hunger. The removal of these hormones usually results in a significant reduction or loss of appetite and a change in taste and food preferences, away from fatty, sugary, processed foods. The operation is done under a general anaesthetic. This means you'll be asleep during the procedure. Sleeve gastrectomy is usually done using keyhole, sometimes known as laparoscopic surgery, or sometimes we also do it via a robot called robotic surgery. The operation usually takes about an hour and a half, and you'll usually be able to go home 1 to 2 days after surgery. Again, full recovery after surgery can take from 4 to 6 weeks. Sleeve gastrectomy advantages. Weight loss starts from the time of surgery, and you can expect to lose between 50 and 70% of your excess weight over a 2-year period. It can also help with the remission of type 2 diabetes. It is technically a more straightforward operation than a gastric bypass to perform, and so usually can be offered to most patients. You are less likely to get dumping syndrome with a sleeve gastrectomy than you are with a Roux-en-Y gastric bypass, as it does not involve repositioning of the gastrointestinal tract. Disadvantages of a sleeve gastrectomy. Weight loss is usually less than that seen after a gastric bypass. Sometimes it can make symptoms of acid reflux worse, and so therefore it may not be suitable for patients who already have bad underlying acid reflux. Again, you will need to commit to taking lifelong multivitamin and mineral supplements. Next, I would like to talk about the one anastomosis gastric bypass, which is sometimes referred to as the single anastomosis gastric bypass or the mini gastric bypass. This type of surgery is a relatively new procedure and was developed as a simpler alternative to the Roux-en-Y gastric bypass. The surgery creates a long, narrow stomach pouch and connects the new stomach pouch to a loop of small intestine. The operation combines restriction with some malabsorption and shares some of the properties of both the Roux-en-Y gastric bypass and the sleeve gastrectomy. Advantages of the one anastomosis gastric bypass. Weight loss starts from the time of surgery, and you can expect to lose between 60 to 75% of your excess weight over a 2-year period. It can also help with the remission of type 2 diabetes, and as it's technically a more straightforward operation than a gastric bypass to perform, it has a shorter operating time. There is a slightly reduced risk of early complications compared to a Roux-en-Y gastric bypass, and in certain circumstances it can be reversed. Disadvantages. There is a risk of developing symptoms of bad acid reflux, and so therefore it may not be suitable for patients who are already experiencing acid reflux. You will need to take the lifelong multivitamin and mineral supplements, the same as what you would do for the Roux-en-Y gastric bypass or the sleeve gastrectomy. You may also experience dumping syndrome. As it is a newer type of surgery, We only have limited long-term data available, although the results that we are seeing seem to be similar to those results gained from people who have had a Roux-en-Y gastric bypass. Next, I would like to talk about the adjustable gastric band. The gastric band is an adjustable device made from silicone which sits around the top part of the stomach. A thin tube runs from the band to an access port which is placed under the skin below the breastbone. The band works by putting pressure on the nerves at the top of the stomach, which makes the brain think that the stomach is full. Fluid can be injected into the band via the access port to alter the pressures on those nerves. The pouch only holds a mouthful of food at a time, and this takes approximately 1 minute to pass through the band. Because the band has reduced the size of the passage through which the food passes and increased the stimulation on the nerves at the top of the stomach, it leads to a feeling of satiety very quickly. It is the action of the food passing through the banded area that makes the gastric band work. The speed at which the pouch empties is determined by the tightness of the band, and when just right, each mouthful should only take about a minute to pass through. This means you'll be able to eat a small meal and then feel satisfied after eating it. The band is not inflated at the time of surgery, and your first bandful will be approximately 6 to 8 weeks after your operation. You'll need to have the band adjusted from time to time as your weight loss progresses. With this procedure, the structure of the stomach and intestines are not altered, so digestion and absorption remain normal. Advantages of the gastric band. Pressure on the nerves at the top of the stomach cause feelings of early satiety and a reduction in hunger. There is no cutting or stapling or altering of the intestinal tract. Therefore, there is a shorter recovery time. You can expect to lose between 40 to 50% of your excess weight over a 2-year period, and the band can be adjusted to meet individual needs. Disadvantages of the gastric band. Weight loss is much slower with a gastric band than it is with other types of surgery. Weight loss may not start until your first band adjustment 6 to 8 weeks after your operation. Most people will require several band adjustments before they get it to a level which is right for them. The band also comes with a very strict set of eating rules, which must be followed in order to get the best weight loss results. The gastric band only works on physical hunger and will have no effect on cravings or emotional eating. There can be potentially problems with the access port, which may twist or leak over time, requiring further surgery to correct it. And also there is a potential for complications if you're unable to adhere to the eating guidelines. Next, I would just like to mention the intragastric balloon. The intragastric balloon is a silicone balloon about the size of a grapefruit, which is filled with saline. It sits at the top of the stomach and helps to limit the amount of food you can eat in one go. It is inserted via an endoscopic procedure performed in theatre under sedation or a light general anaesthetic. Normally it's done as a day case. This means that no incisions are necessary as the balloon is passed through your mouth and down into your stomach using an endoscope, which is a thin, flexible tube with a light and a camera on one end. The balloon needs to be removed after 6 months. A few people do not tolerate the balloon very well and have to have it removed early. The balloon is not a permanent weight loss procedure and is usually only offered to patients with a higher BMI who need to lose a greater amount of weight before a more definitive surgery can be performed. Advantages of a gastric balloon. It's a silicone balloon about the size of a grapefruit which is filled with saline. It sits on the top of your stomach and helps you feel full after smaller amounts of food. It's an endoscopic procedure performed in theatre under sedation or light anaesthetic, and therefore no incisions need to be made. And you can expect to lose between 20 and 30% of your excess weight over the 6-month period. Disadvantages to the gastric balloon. It needs to be removed after 6 months and is not a permanent weight loss solution. Some people may experience nausea and vomiting, especially for the first few days after having it placed. A few people do not tolerate the balloon at all and may need to have it removed early. Next, I would just like to mention the liver shrinkage diet. The liver shrinkage diet is a very low calorie diet that all of our patients need to follow for at least 2 weeks before surgery. The liver sits very close to the stomach and the area just where our surgeons want to operate. The liver is a very vascular organ, meaning it has lots and lots of blood vessels, and this could potentially cause complications if the liver was injured during surgery. The aim of the liver shrinkage diet is for the body to use up all the fuel stored in the liver, causing it to shrink away from the stomach, preventing it obscuring where our surgeons want to operate. This means our surgeons can access the stomach safely and prevents the risk of complications. It is very important to follow the liver shrinkage diet correctly, as if the liver is still obscuring your stomach when the surgeons come to operate, it may mean that your surgery cannot go ahead. Which operation is right for me? Everybody is different, and it is important that we find the right operation for you. These are some questions to ask yourself to help you decide. The bariatric team will also be able to advise you which operation is likely to be the most successful based on your other health conditions, lifestyle and dietary preferences. Questions to ask yourself may include: how quickly do I need to lose the weight? What other health problems do I have? Am I planning to get pregnant? Does what I like to eat affect my choice of operation? Do I have any problems with binge eating? Am I committed to work closely with the bariatric team and attend my regular appointments? Will my eating habits and lifestyle have to change after having surgery? Is the surgery reversible? And will I need further surgery if things go wrong? These are just a few of the questions for you to think about. Lastly, it's important to remember, unfortunately, there are no magic operations. Weight loss surgery requires a lifelong commitment. It's important that you choose the operation that is right for you, as weight regain is possible with all operations if lifestyle changes cannot be maintained. We also ask, if you are currently smoking, that you are smoke-free, and that includes vaping with nicotine for at least 6 months before your surgery. Thank you for listening to this presentation. We ask you now to take a look through the next few slides in order to answer some of the most frequently asked questions. Thank you.